All right, awesome. So I'm so excited to introduce Alaina Reed, who is the Clinical Director for Autism Learning Partners, the South Orange County location, and also for Provo. So she's going in California and Utah here. And we've partnered with Autism Learning Partners a lot for different parent education opportunities, mostly focused on behavior and sleep training. But Alaina actually has a background in IEPs. And so she offered to present to us a really great training on understanding IEPs and how you can make them more successful. Alaina, I'll let you do a little expanded bio. I'm going to turn the presentation over to you and welcome.
Great. Thank you so much for having me today. Like Sylvia said, I do have a lot of experience in IEPs, so I'm happy to share that knowledge with you, as well as how at Autism Learning Partners, we help our families that we serve within that process as well. So I'm going to go ahead and share my slides. Okay. So today we're going to talk about success and less stress in the IEP process. So I'm not sure how many of you on this call have had IEPs in the past, but they can definitely be very stressful as parents, right? You're going in and you're hearing from a bunch of professionals all about your kid, and a lot of times it's a lot of things that you're already aware of, but there's lots of assessments, lots of jargon that's kind of thrown out there too. So what I want to review today is just how you can make that process less stressful, and how if you do need services through Autism Learning Partners, we would be able to support that process as well. So to start, I'm going to just tell you a little bit about Autism Learning Partners. So ALP began working with children with autism and other developmental disabilities and their families 33 years ago. In 1988, we provide AV services to children and young adults with autism and other developmental disabilities. We do accept most major entrances, including Utah Medicaid. And then our intake care team makes the process as easy as possible for families by checking insurance benefits and walking through the approval process. So we'll go into a little bit further like what ABA is and how we can support in the school as well in a little bit. A little bit about me. As Sylvia already touched on this a little bit, I am a board certified behavior analyst, and I have 12 years in the field of ABA and 14 years working with children with developmental and learning delays. So I actually started out as a volunteer working in a reading program when I was an undergraduate. So I have seen a lot of different kiddos with a lot of different learning delays and developmental delays, and have sat in many IEPs. I also work alongside parents and schools in multiple counties. I am the clinical director for our Provo, Utah location. We are currently serving Utah and Salt Lake counties, providing in-home, community, and school-based services for children with autism and other developmental delays. So I'm going to just quickly touch on what applied behavior analysis is, because that's what we do at Autism Learning Partners, is we do applied behavior analysis. So it is a discipline devoted to the understanding and improvement of human behavior, focusing on teaching children skills in the areas of communication, adaptive living skills, social and emotional behavior. So really teaching our kiddos the basics that they need to be able to have a fulfilled life and be as independent as possible. We change behaviors by evaluating the functional relationship between the behavior and the environment. So I know Sylvia mentioned that we have in the past done some behavior training as well. So if you attended those, you know a little bit more about what we do. And I'm sure that we'll partner again and do some more of that in the future. We also make sure that our goals and instructions are individualized to each child and incorporate their daily routines and natural environment. We also incorporate parent training and involvement in the child program. So today, what we'll cover in our presentation are the components of an IEP, tips to ensure success, and ALP's role within the IEP process. So components of an IEP or individualized education plan, this is a working document that outlines the plan to address your child's individual needs. And I highlighted individual because it is individual goals that your child will be working on for the next year until the next IEP. The meeting is intended to discuss assessment outcomes, present levels, review progress on current goals, propose new goals, and identify what support is needed for your child to access their learning environment. So I'm sure that many of you who are on this call today have heard of FAPE, so free and appropriate education. So that is part of the IEP process, is making sure that the services that are being provided to your child in the school setting are appropriate and they're able to access their learning environment. So who attends the IEP? So members of the IEP team include general education teachers who can speak to the general education curriculum that your child would be accessing or may be accessing, the special education teachers, school representatives, which is often the vice principal or a case carrier, parent, student, if desired. So a lot of our older kiddos, it's a great opportunity for them to attend the IEP and really have a say in what goals they're working on. And also hear really great things from their teachers as well. And others with special expertise about your child. So this could be your ABA provider, speech, OT, PT, etc. Just as a note, parents can invite outside people and professionals to attend the IEP if they believe that the person would meaningfully contribute to the IEP process. The school team must be notified in writing of additional participants prior to the IEP. And a release of information for additional participants must be completed prior to the IEP. So if you are inviting your ABA provider, speech or OT or PT, oftentimes the school will need a release of information, as will the provider. So just be prepared to fill those out before the IEP, so that way everyone's allowed to talk freely about your child. So what to expect in the IEP? So IEPs are reviewed within 365 days, so annually. If needed or requested by a team member, they can be held sooner. So if you feel like there has been maybe a big life-changing event, like COVID was one, that affected the way that your child is receiving services or might need additional services, you can always call an IEP at any time. You can do this by, in writing, asking for an IEP from your team. So typically you would be asking it from the case carrier or the vice principal, whoever is kind of the main point of contact for you. If you don't know who that person is, because sometimes it does change, and it's a little hard to keep track of everybody because most of our kiddos have big teams, you can always reach out to their teacher and they can let you know who that person is. Parents are notified of the IEP meeting at least 5 days prior to the meeting date. This can feel really fast. It can, we know that the meetings are coming up, but we're not always thinking about them until it does come up. So I just want to remind you right here that if that date that they're proposing or that time that they're proposing doesn't work for you, you can absolutely go back and ask them for a different date or time. But they will identify a date and time that all of the participants are available. The invitation will include the date, time, location, names, and titles of those invited. Sometimes, because they are such large teams, not everybody is able to attend. So they may ask you if you can dismiss some people as part of the meeting. So it's oftentimes like the adaptive PE coach or the speech therapist or occupational therapist that might not be able to attend. So if they make that request of you, if you feel comfortable with that person disseminating the information through writing or through another person, you can absolutely agree to not have them there. But if you feel like that person's a really important part of the team and you really want to hear from them in person, you can request that another date be selected that person could come. Also, at the beginning of the meeting, parents will be given a copy of Utah's procedural safeguards notice. So these are all of your rights. The IEP team will discuss your child's strengths and weaknesses in the school environment. This is really where you're encouraged to be an active participant in this conversation. Obviously, your child best. You have been with them much longer than the IEP team. And so while they might have strengths and weaknesses that they see, this is definitely a great opportunity for you to be able to advocate for your child and know what, let the team know what you're seeing in your child as well. So some tips to ensure success. I would highly recommend that you read the notice of the meeting carefully so you understand what will be reviewed. So under the most recent reauthorization of IDEA, which is the federal law that all of our IEPs fall under, districts are encouraged to consolidate meetings, meaning that you may be reviewing the results of an evaluation and the IEP in one meeting. So all of our kiddos will have triennials. So every 3 years, they have a big battery of assessments that they have to do every 3 years. So oftentimes the IEP team will address those as well as the IEP in one meeting, which can sometimes feel rushed. So just make sure that you know exactly what's going to be reviewed beforehand to prepare yourself in knowing what you should expect. I would also suggest that you request a copy of the IEP prior to the meeting so you can review and identify your questions. If you're bringing other professionals such as your ABA team with you to the IEP, you can also share this with them prior to the meeting. From my experience, this is very, very helpful. In the IEP, like I said, things go very quickly. Most of the time, the schools are allotting like an hour and a half, maybe 2 hours to the IEP, but that's a lot to go through in that short amount of time. And if you haven't had the chance to read the previous goals, the progress, and the proposed goals beforehand, it can be really overwhelming. So I would definitely suggest making sure that you get a copy of the IEP and then also passing it along to those other professionals. For myself as a behavior analyst, it's always really helpful if I'm going to an IEP to be able to review those goals beforehand, because I can then look at those goals and then the goals that we're working on at home and compare and contrast and say like, oh, we're working on a really similar goal. And, he's actually doing really well at home with the way that we're teaching it. So that might be something that I could contribute to the IEP and let the teacher and the IEP team know how we're addressing it at home. Also identifying the same targets. So our kiddos have a lot of different therapies and school, and making sure that everyone's on the same page. So if we are working on, let's say sight words, for example, making sure that we're all working on the same sight words at the same time, so that way we are really setting up our kiddos for success. I also suggest to bring copies of the previous IEP, doctor's records, progress reports from ABA, speech, OT, PT, etc., to share with the IEP team as necessary. So I always suggest to my families that you, as soon as you have your first IEP or your first diagnosis or any of that kind of stuff, to start a binder where you just can throw it in there and put it in the cupboard. And so then that way, every year when you get that IEP notice, you bring it out and it's all right there for you rather than having to go hunt it down.
I think we might be having a little technical issue. It looks like Alaina might have gotten bumped off the meeting. So I apologize for the interruption, but if you guys can just hang in there, I'm sure she's gonna jump right back on. Hi, everyone. So Alaina just called me on my cell phone and her computer just crashed. She's opening up her other computer and she's going to be logging back on. She said she'll be on in just a minute. So thank you so much for your patience. Sorry for the interruption. If you haven't had a chance to get the slides or anything like that, now might be a good time. Or if you wanted to put any questions in the chat that you might be thinking of. Thank you so much. I apologize for the little glitch here, but Alaina will be jumping back on very soon. Welcome back, Alaina. I see you're getting connected. Thank you for being so quick to grab another device and jump back on here.
Of course, I'm so sorry. I have no idea what happened. My screen just went blue.
I thought it was my internet that froze at first. So
No,
thanks for getting back on so quickly.
of course. Let me pull back up the PowerPoint. While I do that, does anybody have any questions?
We just had a question that came in the chat. The question, let's see. A roommate who is a student teacher for 5th grade. The main teacher has the parents, talks to the parents about goal setting and an IEP. And that I remember that the teacher and the student teacher are making goals, working with how many hours and time management and numbers and math, as well as learning on reading and how to practice and handling emotions. Are all of these things covered in an IEP?
Yes. Yes. So any goals that the child is working on should also have a goal within the IEP that is measurable. So that is part of what we will definitely be talking about a little bit later in the slides as well, is making sure that those goals are measurable, so we can make sure that the kiddos are actually, making the success that we're wanting.
And we have one more question in the chat. This question is, my son turns 3 in July, so we are going to be going into our first IEP in a couple months. We had an initial meeting yesterday to set up his evaluations at the district, and I asked about a draft IEP that we could review before meeting, but they said they don't have one that they can share ahead of the meeting. Is this something I can push back on if you recommend getting a copy ahead of time, or is that just once one has been established?
So you should typically be able to still get one even before your first IEP. I would definitely ask them again. If they say that they are still not able to provide that, I would just let them know that you'll attend the IEP, but you may not want to sign it at that time, because you'll want to have some time to review it before.
Awesome, thank you.
All right.
And those are the only questions in the chat for now.
Good. All right. I'm almost ready. Sorry, I have to re-download the slides on this computer. Glad I had a backup though. All right. All right. We are back. Okay, here we were. Thank you guys so much for your patience while I navigated that technical difficulty. So start the meeting by making on a positive note. So I would suggest, thanking the teachers, the staff for supporting your child. It really sets a nice tone for the IEP. IEPs can sometimes be contentious because you are advocating for your child in that meeting. You're also hearing a lot of things about your child in that meeting that you may not experience. Right, seeing your child at home or out in the community or on the playground is so much different than the school environment. So it's great to kind of set the tone by just thanking everybody for taking their time and for supporting your child. Or if there's one person in particular that's really like gone above and beyond, just making sure that they know how appreciative you are. I would also suggest to let the team know at the beginning of the IEP that you do have questions that you would like to address throughout, so that they can allow time. Again, it's a very short amount of time to go over so much information. So it's really helpful that they know that you are planning to be an active participant in this meeting and that you have questions, so that they can be mindful of that as well. Also ensure that the goals are SMART. If not, ask how they will be evaluated. So SMART means specific, measurable, attainable, relevant, and time limited. Also, I would definitely suggest to take your time in the IEP. It can be very stressful to think that you only have like an hour and a half or 2 hours for this meeting. But I do want to share with you that if you don't get through everything, a part two can always be scheduled. Um, it's not something that they do initially because they're hoping to get through everything in one meeting, but there's often times that a part two is needed. I'm not gonna lie, I've been in IEPs that have had part threes and fours. That's definitely unusual. That's not typical. I would say most first IEPs are usually like one meeting just because it's a lot of information. And like I was saying earlier, is really making sure that if you're not comfortable with signing that, you didn't get it beforehand, you really want to take it home and digest what is being presented to you, or even ask other people in your life what they think. You can definitely do that as well. You do not have to sign the same day. So talking about the goals, we want goals to be addressed at specific areas of concern. So we would not want a goal to say Ethan will improve his reading skills. What we would want is Ethan will increase his ability to read by reading 30 words per minute aloud with 80% accuracy on 4 out of 5 days of data collection. So that second goal is very specific. We know if he can do that on 4 out of 5 days, he's proficient in this skill. The first one is too vague. Measurable. So goals should be worded so they can be measured using a standard level of competency. So what we wouldn't want to see is Lauren will increase her reading comprehension by answering WH questions. What we would want to see is Lauren will increase her reading comprehension by answering WH questions with 80% accuracy on 4 out of 5 days of data collection. So again, making sure that that goal is measurable. We want to know how many, what are we looking for? Do we, in this particular goal, we're saying that Lauren is going to answer WH questions in 80% of opportunities, and we're going to take that data across 5 days, and 4 of those days she has to get at least 80% for this to be considered mastered. Again, just the goals for an IEP are annual. So from one IEP to the other, that's how they're written and that's how they're expected to be mastered. So every year, your child should be getting new goals that they are expected to master in the next year. Sometimes those goals are similar, but the measurement changes a bit. So we might start out with Lauren being able to answer questions in 60% with 60% accuracy. And then the next year, it might go up to 80% accuracy. Attainable. So goals should be written to be attainable by the expiration date of the IEP. So kind of what I just said. So all goals are met within that year. So this is hard to predict. And this is where I think you as a parent come into play. Really, it's just so important for you to know and be able to express to the IEP team what your child's learning history has been, especially when you are transitioning between schools or between grades, or not between grades, sorry, between like elementary, middle school, high school, really being able to tell them, he his reading acquisition is slower, or his reading acquisition is really fast. So kind of helping them to be able to write goals that are going to be attainable. So what we wouldn't want to see is that Alden will increase his ability to independently converse with peers and adults for 3 exchanges 80% of the time on 4 out of 5 days of data collection. What we would want to see is Alden will increase his ability to independently initiate conversations with peers and adults with 80% accuracy on 4 out of 5 days of data collection. So the difference between these two is that in one, it's full on conversations. And this kiddo that this was written for, he didn't have conversation skills. So that's not going to be attainable most likely in a year. Really what we're looking for is like that independent initiation of conversations. That's going to be attainable. One thing to also note is that if the goals are mastered within the year, you should be getting quarterly progress reports from the school, or at least a mid-year progress report from the school, and that will show you where they are on their goals. So a goal has been met, they can put in a new goal. And if that's something that they're not doing, that you would like to request for, again, you can request another IEP meeting outside of your normal annual IEP meeting time. Relevant. So goals should address the concerns from the IEP team members and evaluation results in the present level. So an example of a goal that we wouldn't want to see is Josie will choose the correct operation to solve 2-digit addition and subtraction word problems with 80% accuracy on 4 out of 5 days of data collection. What we would want to see is Josie will increase her ability to solve 2-digit addition and subtraction problems without regrouping with 80% accuracy on 4 out of 5 days of data collection. So we want to make sure that the goals are relevant to our child and to their level and grade level as well. So kids learn to do addition subtraction problems without regrouping before they learn how to do it with regrouping. So being very specific and relevant to what your child is needing. Time limited. So goals should be written to ensure that the skill is mastered within the IEP period. So again, we talked about that a little bit earlier, but we want to make sure that it's written in that way as well, so that way the goal won't roll over from IEP to IEP, or potentially say that it was mastered just in one observation. So Kane will increase his ability to use appropriate verbal responses with 60% of the time. So 60% of the time, that doesn't really tell us, how often he's doing it. If he does it one time at 60% of the time, does that mean that he mastered the skill? No, right? Like we wouldn't say that just because he did it one time means that we can move away from it. So what we would want to see is Kane will increase his ability to use appropriate verbal responses with 60% accuracy on 4 out of 5 days of data collection. So it's really identifying what that data collection is going to be. Sometimes schools will also add in like a month. So 4 out of 5 days in a month could also be part of those goals. Before I move on, does anybody have any questions about that section?
And feel free to either type your question in the chat, or we have a small group, so you can also unmute your microphone if you just want to do it that way as well.
Okay, it looks like there weren't any questions from that part of the presentation. So I'll continue to move on, and then we'll allow some questions at the end. So if there's any questions that I didn't get to, please make sure that you type them in the chat, and I'll address them at the end. Or at the end, you can hop on, like Sylvia said. So ALP's role in the IEP process. So again, like I explained earlier, we are an ABA company. So we do provide individual ABA services in home, school, and community settings. With that, we do assessments to begin services, as well as goals that we implement, and we write a new report every 6 months, evaluating those goals and providing progress. So because of that, we, as a participant in the IEP process, we are we have a special expertise about your child. We've seen your child in multiple settings, and also worked with them one-on-one in learning skills. We can provide a professional's assessment of your child's skills and deficits, as it pertains to ABA and the areas that we're working on. So, like I said before, we work on many, many different areas of development. So we can definitely participate in the conversation during the IEP about those different skills and deficits. And we might be able to also provide some expertise in the area of what prerequisite skills we might be working on in our ABA sessions that really affect your child's progress in school. So, for example, a lot of our kiddos, we work on attending to a non-preferred activity. So that would be potentially for our littler ones, sitting down and reading a book and sitting there while an adult actually finishes the book. So that is a really important skill for our kiddos to know when they're going into school, because if they're not able to sit and actually attend, their learning opportunities are very limited. And we can also provide a copy of the most recent progress report with goals. So again, what part of what we do is every 6 months we reassess your child's goals, as well as standardized assessment measures, so we can provide that progress to the school team to let them know what we're seeing. So what is your child capable of in a one-to-one setting, being able to acquire skills versus the school setting, which is going to be, it's much different. But it is very helpful for us to be able to collaborate. So we do collaborate with the school team on goals previously or currently in progress during ABA sessions. And that collaboration does occur in and outside of the IEP meeting. So as the ABA provider, because we have so much contact with our clients, we take on that role of being the primary professional to reach out and collaborate with other professionals. So every 6 months, we reach out to our clients' schools, speech, OT, PT, primary care physicians, neurologists, whoever is on their team. We reach out to them and collaborate and just, find out what they're working on, let them know what we're working on, so that way we can have like a very nice, well-rounded approach, and that everybody's on the same page. That brings me to the next point of us collaborating with the school team on a behavior intervention plan that will work at home and school. So if your child's having behaviors at school that are interfering with their learning, and we're also seeing those at home, we can provide the school with the information of what we're doing at home, to be able to support your child in school as well, and make sure that that's a seamless process. We don't want to say, school is doing this and home is doing this, and them not be talking to each other, because that's not the best for your child. Great. Does anybody have any questions? And I apologize, I cannot see the chat on this computer. So if there's anything in the chat, Sylvia, if you wouldn't mind letting me know.
Of course, yeah, I'll read the chat if any questions show up there. We'll give you guys a couple minutes. If you prefer to use the chat, you can type it in there. Also, if you prefer to just unmute your microphone, you're welcome to do that as well.
And if you don't have any questions right now, but you have questions later that you think of, please feel free to reach out to me. This is my direct number, and this is my email address. Learningpartners.com. I think I saw. Let me see. I think that there's one in the chat. It says, with that, it is good for a student teacher, can help in the behavior because she has a lot of tricks that she can use to help with the behavior. Yeah, definitely. It's so nice for a teacher to have a student teacher in their classroom. Just to have that extra body is like so important. And it's great for the student teacher to be able to really get to know the kids and learn the tips and tricks from the more seasoned teacher. But that's great that it sounds like your roommate has some great behavior strategies that she can share. Let me go ahead and stop sharing so I can see.
And Alaina, I have a question that I hear from parents sometimes where they have specific goals or maybe specific times that their child has been they put in the IEP, your child will be working with the speech therapist for this many minutes or hours a week. And then sometimes that doesn't happen, for whatever reason, maybe the therapist is out sick or for whatever reason. If a parent is finding that some of the goals and kind of the plan in the IEP is not actually happening, what would you suggest for that parent to do to follow up if they, or if not feeling like their child's getting the attention that they deserve?
Yeah, definitely. So the IEP is a legal document. So that is the contract with the school district for those services. So if you feel like your child is not receiving those services, I first of all would reach out to the case carrier and find out, what's going on. Sometimes, unfortunately, sometimes there's like resignations in the middle of the school year, and so they're like between speech therapist and they're planning to add additional minutes on when they get the new speech therapist. But if you're not getting the answers that you want, or that you feel like you're kind of getting the runaround, because that definitely happens. Most of the case carriers at schools are carrying quite a big case. I know when I worked in Los Angeles, some of those case carriers had like over 100 cases. So it definitely sometimes, unfortunately, gets lost in the shuffle. But I would definitely reach out via writing and ask for a IEP meeting. So again, you can ask for a meeting at any time throughout the year, and they do have to provide you that meeting. I believe it's within 60 days. So it can take a little bit of time, but it's definitely worthwhile if you're feeling like that's not what you are wanting is not happening.
That's great. And I know you mentioned earlier that it's always great to start out these meetings very positive. We're all working on this together. We're a team. What other tips do you have for a parent who's looking to advocate for their child and wants to be assertive and confident in their requests, but doesn't want to come off as pushy or kind of damage that relationship and become, that person that is, being received in a negative way?
Yeah, definitely. And it's hard. It's hard to walk that line because we want what's best for our child and we want to make sure that that's conveyed. And it can get very heated sometimes in IEPs when you feel like what you're saying isn't being heard. So I would definitely suggest making sure that if you have those questions, if you're able to get that IEP beforehand and you have those questions, that you either let them know that you have questions at the beginning that you want to address, or if you feel like you have a lot of questions, you could even send those questions over to them prior to the IEP so that they're prepared to answer them.
Thank you. We
Yeah.
have another question in the chat. What are our rights concerning IQ testing? Is there any benefit to refusing that testing?
That's a good question. So I'm not an advocate, so I don't know the specific rights. I would say for the most part, there isn't any benefit in refusing a test for the most part. So, the school districts are looking to see if your child meets the criteria for one of the disabilities um, that they can have an IEP for. So they're not trying to not give you an IEP based off of an IQ test. That's also why I would suggest if you do have doctor's records, to always have those available as well. Because if your child does have a diagnosis outside of the school, while that doesn't directly it doesn't directly go to the school and like make them have to give you an IEP. It will give them a lot of good information as to why your child would need an IEP. That's a great question, though.
All right, thank you so much. Are there any other questions that you have right now? Feel free to use the chat or you can unmute your microphone. We'll wait a few more minutes.
I see one more. It says, is that for normal or for any kind of disability, including with all kinds? Sorry, I'm not, would you mind hopping on and clarifying that question for me? So yes, so IEPs, they do cover Down syndrome and autism, as well as other like learning disabilities. So dyslexia, I can't remember like the whole list, but it is in the, I believe it's in the parent rights that it would say what the eligibility criteria is. If it's not in there, I would honestly just Google eligibility criteria for IEP. And it should also give you some of the eligibility criteria, but it does not have to be like Down syndrome or autism. It can be a learning disability. It can be like other developmental disabilities. It can be health conditions. So I had a kiddo have like a very rare medical condition who had an IEP as well, because it did affect his learning. And then there's another question that says, what does a transition out of school IEP look like? What things should services should be asking about? That's a really good question. So under the IDEA law, students are able to access school services until they're 21 years old. So as they get older, and I'm not sure about your case, if your child is in high school and going to be transitioning out of the school in that manner, or if they're 20. Okay, perfect. So high school, they should also have some sort of plan after school. So there should be a transition meeting that occurs, and it would address, is your child going to get their GED? Are they going to get the diploma? What that would look like, as well as if there's any other services that they can be provided after they're done with high school, because there are vocational programs where they work on specific vocational skills. There's also like adult programs where they work on independent living skills. So skills such as cooking, cleaning, doing laundry, making sure that they know how to exercise, how they know how to use public transportation. So yes, there's definitely other services after high school. So if that's not already part of the conversation, I would definitely reach out to your case carrier and ask them, what they're thinking for your child, because that transition meeting can come up pretty quick. And so it's nice for you to be able to know what they are thinking as a recommendation going forward so you can prepare. Such great questions. And I think I did mention it before, but I do just, want to reiterate. I know that Megan mentioned, not maybe not having the IEP before. And this is just for everybody. I want you to know that like your right is that you don't have to sign that IEP that day. It oftentimes feels very like a lot of pressure to need to sign it or agree to all the things that they're providing you, but you don't have to. You are able to take home the IEP, think about it. They will have you just sign in saying that you are in attendance, but you don't have to sign the IEP agreeing. If you don't agree, you can agree to parts of the IEP. If you do that, if you already have an existing IEP and you only agree to parts of the next IEP, the parts that you don't agree to will actually continue on. It is a legal document. So until that is legally changed, those same parts. So like if they're recommending a decrease in speech, for example, and you don't agree with that, your 30 minutes of speech per week, maybe that you're getting, would need to continue on until you came to a consensus with the IEP team and received a new IEP that you signed off on. So I hope that this was helpful for you guys. Again, I am available to you if you ever have any questions about IEPs or if you have questions about ABA. I would love to connect with you.
Awesome. Thank you so much, Alaina. I put your email address in the chat. So if you guys do have questions that you want to follow up, you can email. Thank you so much for putting together this presentation for us and for taking the time today to walk through some of these steps and these tips to help make the IEP meetings more successful. We really appreciate your time and we look forward to collaborating with you again and seeing you for another opportunity.
Perfect. Thank you so much, Sylvia, for this opportunity. I really enjoyed meeting all of you guys and having the opportunity to talk about IEPs.
Awesome. Thank you so much. And thank you everyone for joining us. I hope you guys have a great day and we'll see you next time.
Bye. Thanks.
Bye.